Hello everyone, what we are going to learn today is acupressure for dysphagia. Stroke is the fourth of the top 10 causes of death in the country. And patients with stroke, between 30 and 60% have difficulty swallowing. 34% will produce pneumonia. Compared to stroke patients who do not have dysphagia, the risk of death is 8.5 times higher. The action of acupressure is turned. It is used to stimulate the muscles and nerves under the acupuncture points. Activate the brainstem through the spinal cord of neural signals. Neurons such as the hypothalamus. Dysphagia as assessed by a medical professional. Massage of the relevant acupressure points can be performed. How does acupressure work? In the way of drawing circles. Slowly press and rub the acupuncture points to make the acupuncture points sour. The feeling of rising. For each acupuncture point, press for 1 minute in a gradual and intermittent manner. Compress 3 times a day before meals. The first acupuncture point is the Baihui point. Its name is because the head is the place where the yang energy of the whole body gathers. All diseases are cured, so it is called 100 meetings. The Baihui point is located at the connection between the ears and the intersection of the central line between the eyebrows on the top of the head. It calms the wind and clears the mind. Enhance yang energy and prevent organ drooping caused by weak yang energy. It is used for stroke, speech obstruction, silence, and hemiplegia. The second acupuncture point is the Fengfu acupoint. It is named because the acupuncture point is the gathering place of wind and evil. It treats all wind diseases, hence the name Fengfu. The Fengfu point is located an inch above the hairline in the center of the back of the head. That is, a thumb width. Evacuate the wind evil, restore the normal operation of the air engine, and calm the internal wind. Dredging the meridians, relieving the blockage, so that the qi and blood can run smoothly. Awake, used for tongue urgency, tongue slowness, and hemiplegia. The third acupuncture point is the Fengqi acupoint. Its acupuncture points are on both sides under the occipital bone. The depression is like a pool, and it is the key point of wind control, so it is called the wind pool. To find the Fengqi point, you can go up on the neck along the 2 sides, below the occipital bone. Hairline depressions can promote increased blood flow in the vertebral arteries. Inhibits the progression of dysphagia. It is used for stroke and soup cannot be swallowed. The fourth acupoint is the complete bone point. The complete bone point is located on the high bone behind the ear, which is as complete as a city wall. It protects the mind and nervous system, so it is called complete bone, and it is called papillae in the West. After finding the bone point, you can find the occipital bone at the most protruding point behind the ear. That is, the bone bulge behind the earlobe, also known as the mastoid. The lower end of the mastoid process is concave, one on each side. It can be used for headaches, cerebral congestion, facial nerve palsy, laryngeal paralysis. The mouth and eyes are crooked. The fifth acupuncture point is the Yifeng acupoint. I means to cover. The acupoint is located in the depression behind the ear, treating colds. The wind point behind the ear is called the wind. Look for the wind point in the depression directly below the earlobe pressed back, one on each side. The deep part is where the facial nerve penetrates from the skull, improves the protection of the whole brain and increases blood flow to the damaged area. Irritation of the soft palate or back wall of the throat. Induce the swallowing reflex and strengthen the muscle groups associated with swallowing. It is used to treat crooked mouth and eyes and trismus. The sixth acupuncture point is the pulp point. Chung refers to acceptance, pulp refers to the slurry and saliva in the mouth, that is, saliva. This point receives the saliva in the mouth, so it is called pulp. Location of the pulp acupoint. In the depression between the lower lip and chin. The pulp point has branches of the facial nerve and labial nerve. It is used to produce fluid and fluid, relax meridians, and activate circulation, and inhibit drooling. The seventh acupoint is the Lianquan point. Integrity means purity and cleanliness. The fluid produced by the sublingual gland is like a clear spring, so it is called Lianquan. To find the Lianquan point, first raise your chin. The thumb joint striation is located at the midpoint of the mandible. The mandible is the bone of the jaw. The thumb is facing the Adam's apple, and the fingertips touch the Lianquan point. There are branches of the hypoglossal nerve in the deep layers. It can improve tongue weakness. slowness of movement, difficulty lifting or flexible movement. It leads to slurred speech or even inability to speak, as well as difficulty swallowing. The above are the 7 common acupuncture points for stroke swallowing difficulties. Dysphagia after acute stroke. Within 21 days is the period of fastest recovery of swallowing. In the hospital, speech therapists will guide swallowing training, regardless of whether the patient can cooperate with swallowing training-related movements. You can assist the patient in the massage as described above. It can continue until you get home. Improve the recovery of swallowing function in patients. I am a nurse at Hualien Tzu Chi Hospital. I Bodhi Wisdom. Thank you for learning today. You are also welcome to watch the review repeatedly. Wishing you all the best and peace.